I'm Carrie Bourne. I'm from the Office of Continuing Education at UW-Whitewater, and we have been hosting the lecture series over here at Fairhaven Senior Services for almost 40 years. And each semester we focus on a theme, and this semester we're focusing on new faculty who have joined UW-Whitewater in the past few years. We have lots of interesting different topics this time around. And I'll go ahead and introduce today's speaker. Jonathan Dellinger recently joined UW-Whitewater as a professor of health communication. He previously worked at Wake Forest University and University of Kentucky, and he earned his graduate degrees at the University of Wisconsin-Milwaukee. His research involves human cognition, health, and culture. Some of his recent work involves developing new ways of measuring health and well-being across different cultural contexts. His wife is also a professor of communication, so he's used to healthy arguments about these concepts. He has 3 kids and enjoys creative writing and music and likes to paint pictures of monsters when time allows. Please welcome Jonathan Dellinger.
Thank you very much, Carrie, and thank you, everyone. If I need to speak louder, just go ahead and give me a thumbs up. I will interpret that as criticism, not praise. As Carrie said, I am Jonathan Dellinger. I recently joined UW-Whitewater. I'm very happy to be here. What was not in my introduction there is that I am a native Wisconsinite. I consider southeastern Wisconsin to be my home. Spent most of my life in Milwaukee area, and so I'm very happy to be back here. And I'm really happy to be engaged in the community and have this opportunity to speak with you today. The topic is talking to doctors, health communication tips to improve your healthcare experience. As I began developing this lecture, I started feeling like I could probably cover those tips in about 1 or 2 slides. So we fleshed it out with some other lessons from health communication. And hopefully you find this information interesting and relevant. If you get bored, that's okay. Go ahead and doze off. I'll wake you up when we get to the tips towards the end. You know, I anticipate most of you could probably sneak in 1 or 2 naps along the way here. We got 45 minutes. So, but let's get into it. Before I get too far along, I decided this was the picture I was going to use today. This is my desktop background. It's one of my, well, it's not a monster, but I painted this one. And it seemed appropriate for the mood outside. I don't know. But it also seemed appropriate because I painted this robot long before I started getting old enough to feel the aches and pains that just start kicking in after somewhere around 25. So I still got a long way to go. I hope I can make it last for a good long while. I'm happy to see so many spry young people here in the room today. Congratulations. So, but this robot, even back then I was anticipating some of the difficulties of life, sentient and mechanical and otherwise, and he's a little rusty. He's a little worse for wear here. And he seems to be asking the skies above what he can do to be healthier. So let's explore these ideas a little bit. Let me just start with a few questions. Feel free to answer these if you want or not, just for your consideration. But do you feel healthy? Yeah. That is wonderful. I love to hear that. If you don't feel healthy, that's okay. A little stiff. Well, I'm right there with you, so I will defer to your judgment on that. But maybe we can explore this a little further. When do you feel best? You can think about that to yourself. You're welcome to raise your hand and join in if you like, but what sort of activities make you feel the best? Sometimes that could be exercise, it could be eating, it could be taking a nap, it could be talking to your doctor. Just a little louder? Okay, yeah. So what I'm trying to get at here is to engage with what it means to be healthy to you, because health is ultimately a subjective experience. I assume most of you know what I mean by that. That means that it is unique to the individual and our position in society, our culture, and our physical well-being is only one part of that. And so in order to be healthy and well-being, we have to explore these ideas a little bit. Modern medicine is starting to reflect that a bit more. I should say Western modern medicine is starting to reflect that a little bit more. You see holistic medicine and yoga and mindfulness and all these things popping up. And these are important aspects of as well of health, but none of these things captures it absolutely. So we want to engage critically, we might say, with what it means to be healthy and what makes us feel healthy. But additionally, this question down here, which try as I might is probably still illegible to you, is what sort of barriers do you experience in relation to your health? This could be physical limitations of your own body. It could be societal limitations imposed on you by just the structure of getting around. It could be access to health care. It could be the cultural attitudes of the times. I'm sure we all let that get us down from time to time. But we want to try and explore some of these ideas a bit deeper. So here's a little background on me. I figured I could try and get as many pictures in here as I can just to keep this interesting, because the material's not always that interesting. But who am I and why should you care, or should you care in this case? Well, here's some pictures of me and my family. These are pictures of me feeling healthy. I lived in Japan for a number of years, and I'm active in a taiko group. Anyone know what taiko is? It's a big drum. That's all it means in Japanese, but it's a Japanese drum. Has a very distinct sound, and I've played that for, I don't know, maybe close to a decade now, off and on, of course. So that's one way I stay active and healthy. I spend time with my beautiful children. Here's my oldest son enjoying sushi, which is nice and healthy and his favorite meal. So anyway, I am, as I mentioned before, a professor of health communication, and I've done a lot of different things, and that ties into what I think is healthy. Part of my subjective healthy experience is experiencing things. I might be, my grandpa might call me a jack of all trades, not so good at any one thing, not an expert of any, but, I've done a lot of reflection on that, and I think that that's just the way I like it. I like experiencing different things. That's part of my concept of health. Now, my interests and my background are the most complicated way I could probably say it is fundamental human cognition. That is the area of interest that unifies all the different things that I've studied. What does that mean? Well, in particular, I'm interested in the intersection of health, culture, and individual behaviors and cognition. So all those little things deep within our nature, inside our brains, that we've either learned or been born with, and how those express outwards through our families, our friends, our culture, our society, our community, and what does that have to do with health and how we can be healthier? And in the recent months, I've been really exploring this idea of quality of life and trying to figure out how we can feel healthy even when our bodies aren't always cooperating with us. So I have a great deal of experience in public health background. Most of my graduate studies were involved in public health at UW-Milwaukee, a little bit of freshwater science, mostly public health, and an intercultural background, which is how I got into communication. So if you think about all that, it kind of makes sense the way I'm going to talk about these things. My methodology, for those of you who are interested, is statistics. I do a lot of survey work and develop new ways to measure through something that most of us are familiar with and probably don't like all that much, surveys. I use that to try and track these deep-seated fundamental human behaviors and see, can we measure those? Particularly by asking questions. And then I do a bunch of math magic to try and see if we can measure things a little bit more concretely. So anyway, this lecture is going to be broken into 3 parts, and I will try to keep it on time. If I start rambling, you can just do this. I'll try to get back on track. I'm going to cover a little bit of health communication as an overview to kind of familiarize you with the field and the perspective that I am taking. I'm going to cover some definitions, the challenges and significance that health communication experts face. You can probably use your imagination for a lot of that. This is an interesting time to be alive for certain. And then I'm going to talk a little bit about the healthcare context. That would include current trends and issues in the healthcare field and communication, particularly in relation to us everyday people who have to interact with doctors. And also I want to talk a little bit about patient and provider identity. Not too much, but enough that we can kind of have some reminders that we're all humans in these interactions trying to just get through the day. Now, there are also some competing perspectives of health. Some of this is cultural, but we're going to talk about that a little bit as well so we can resolve some of these issues. The third part, that's the tips, okay? So I will get to it. The tips for improving your health and well-being. I'm going to take this from two different perspectives. One, in terms of navigating the healthcare exchange, as the title of the lecture suggests, and then just some general tips for your well-being. Those are going to be pretty straightforward. I don't think they're going to be very surprising, but maybe by getting really complicated and then narrowing it down, we'll have a little more context for why we should do the things we should do. So let's get into it without further ado. What is health communication? Health communication, well, let's start with the definition of communication. Communication can be thought of as, this is my definition. I see lots of complicated definitions in all the textbooks I'm teaching from all the time and the papers. I think this one works just fine, but it is a bit broad. The study of any site of human interaction. Wow, that's pretty broad, isn't it? That's a huge, broad umbrella. And that explains, in some ways, why health communication scholars, well, we do all kinds of things. There's statisticians like me, social scientists, social psychologists, but then there's people who write more manuscript, essay-type things and papers. And so we all have different sometimes competing perspectives. You losing me there? There we go. And we operate under different assumptions at times. Now, health communication is an extension of that. I would say is intended to, any communication that is intended to or might influence health and health choices. Still pretty broad, I think. So here is one of the technical definitions that comes up in my textbook a lot that I think is also acceptable. The way we seek, process, and share health information. But is that really any more specific? I don't know. Maybe we're never going to get on a really solid, concrete explanation of health communication beyond what we already kind of intuitively understand. We're talking about anything that involves a human and another human interacting, exchanging information in such a way that it might influence our health. If that sounds like literally everything, it probably is. Every day, we are doing this all day. Even if we're not thinking about it, we are making decisions regarding our health and well-being. Here's a little citation for you. So this definition has not changed much in the past 30 years. Now, why does it matter? The success of healthcare depends on clear communication, not just between you and your provider, but also between your provider and other experts, other professionals, specialists. I myself have psoriatic arthritis. I have to see a rheumatologist regularly, as I'm sure some of you probably have to. That alone, it complicates things very quickly. The more people you throw into this mix, the more complicated it gets. And the success of healthcare depends on that. It also helps healthcare organizations operate effectively. When we don't have clear communication in healthcare settings, we have all kinds of issues. We have inefficiencies, but we also have scarier things, such as medical mistakes. That happens too. They're not super common, but they do happen. Again, we're all human, including our doctors, who are a little tired much of the time. Now, we also have media. Social and mass media, which provides good and bad information. This includes the telephone, the television, the smartphone, computers, and everything in between, which are becoming more and more pronounced in our day-to-day lives, whether or not we like it. I don't like it, but it is part of how we live our lives now. Now, the good and bad information, can you tell the difference? And that is tricky. And it's hard to know when you do know the difference. So this can really only be helped by improving our health literacy. We have to be engaged with our health and health information. But health literacy is also related to the technical information. Are we prepared to engage with the tools that get us that information? Now, good communication can additionally improve confidence and comfort. Not just in your day-to-day life and in your healthcare interactions, but for yourself. Communication itself is therapeutic. That's one thing that us communicators really like to say as communication people, that communication itself is therapeutic. By that, I don't just mean talk therapy, right? Going and talking to a psychiatrist or something like that. The act of sharing our perspective is, in fact, therapeutic. It makes us feel better, and it helps improve our health. We'll get into that a little bit more as well. Clear communication, health communication also saves time, energy, and money. All things we value. Now, health communication in the changing world. We have, as I mentioned on the previous slide, we have some new challenges that are emerging all the time that we have to deal with. So what is it like now in the current world? Kind of a cross-sectional look here. We have global health risks. Well, we've got the obvious example of COVID-19. It comes up every day. It just doesn't seem to want to leave us alone. It is in the news. It is on Facebook or whatever social media you may be unfortunate to be using. It's on the radio. We can't escape it. And when you go to the store, when you go out, we just have to deal with this. So this is an example of a global health risk. And we've been talking about the global health risks since before COVID came about, and a lot of the protocols that we had in place and established beforehand, well, some of those kind of went out the window, which was surprising to people like me, because I thought that was why we had the protocols, but I'm not going to rant about that today, unless you twist my arm. But we at least can recognize the complexity of our health environment. It is not Walworth County. It is not Milwaukee and Madison. It is not southeastern Wisconsin. It's not Wisconsin. It's not the Midwest. It's not the United States. It's the whole world. And these things travel fast. Particularly, one of the things we have learned from the COVID-19 pandemic is how quickly respiratory illnesses travel. Part of that is their nature and their life cycle, and there's a reason why we get respiratory outbreaks all over the world rather than, say, Ebola. You hear about that disease periodically, and there's another Ebola outbreak, which is an awful, awful illness, and it's got a much, much higher mortality rate than COVID-19, something like, I think, 30 to 90%. Like it ranges because it depends on the population, but even 30% death rate is very, very high for a disease. Because of it, it doesn't spread very quickly. The coronavirus does, and other respiratory illnesses do. They have a longer incubation period. They last longer. People are able to walk around and travel, hop on trains, airplanes. At any rate, you can start to recognize some of the complexity of this situation. We have other global health risks, not just viruses. We have antibiotic resistance on the rise. That happens when we overuse antibiotics, but it also just happens because bacteria are alive, and they, like us, would like to continue to be alive. But unlike us, they reproduce much quicker. That leads to antibiotic resistance. So that's another issue. But we also have pollution. We have all these different things. How many of these masks have ended up in the ocean? And should we care about that? Probably, but we don't know yet. And at any rate, global health risks, that is something that we have to deal with. And so we can come back to this when we talk about technology, but technology is one of the ways in which we try to deal with these global health risks. As complicated as it seems, those are some of our best, most effective tools. Now, we also have an aging population worldwide. Japan's a good example of this. We are as well. We have an aging population. Most developed countries do have an aging population because our quality of life increases, people live longer, and as the population increases, the birth rate slows down as well. Japan is an example of this. This year, Japan's over 75-year-olds topped 15% of the population for the first time. I'm not sure how much context that really gives you compared to the United States. Let's see, can I have that on there? I can't remember what oh well, at any rate, but you can almost see down here that they're also hitting record highs this year. We're over 65-year-olds or seniors, accounting for 29.1% of the population. That's 36.27 million people in Japan are over the age of 65. I lived in Japan for, here we go. I do have the statistics. So this, in the United States, 38% is, 38%, in Japan is over 60. In the United States, it's 22%. But that's still an increasing number as well. But yes, I lived in Japan for about 3 years, thus my love of taiko and sushi, and I was in and out of the healthcare system there. I got my tonsils removed in Japan, of all places. And I remember the doctor telling me, he's like, well, you should probably have them out, but are you sure you don't want to wait until you go back to America to get that done? And I was like, nope, no, take them out. Scoop them out with an ice cream scoop. I don't care. I'm not going to do it in America if I can help it. And it was quite a bit cheaper. The Japanese medical system is more geared towards prevention than the Western system. That seems to help. But there are other considerations as well. The Japanese population is very homogeneous. What do I mean by that? Well, everyone kind of looks the same. Right? They're similar cultural homogeneity. They, not just in terms of their physical appearance, but culturally, they're very homogeneous. We are a very diverse culture, the United States. By that, I mean we. That can complicate things too. It's not as easy as just say, for example, changing our whole healthcare system to give everyone immediate healthcare, right? That, well, we have to wrangle with a lot of different perspectives and philosophies about healthcare to do that. But anyway, I am getting off track a little bit. But aging population is something that the whole world is going to have to deal with the exception of South America and many African countries. That also leads to migration trends. So that leads to increasing diversity that we have to deal with. All right, this is tied to the migration of labor. As you have aging populations, you also have increased migration of labor force. So young workers come into the country to fill the jobs that the aging population is letting go, right? That's a pretty natural trend, but one of the things it contributes to is diversity. So greater diversity leads to a lot of great things, cultural exchange, creativity, explosions of all sorts of stuff, but it also leads to intergroup tensions, as you may also see on the news. Even if you don't have negative attitudes about different groups, there are many people who do, and that creates tensions that must be considered as we go forward. So that's another thing too. And to bring it back to health and health communication, how do we deal with that in our healthcare system? Right? We might assume, you hear horror stories of like the Canadian system where you've got all these, influx of migrants and refugees and they bog down the system. And, well, that might be partially true. We don't have to attach a good or bad assessment of that to recognize that it's still something we have to deal with. In Walworth County, we have a very high percentage of the Hispanic population. So doctors are going to need to be prepared to deal with interpreters, different cultural perspectives of health, different traditions, different health beliefs, and all of this starts getting very complicated very quickly. Again, we have to deal with this global world we have now. Of course, there is the technology as well, the good, the bad, and the ugly. I think if I had to summarize technology in one phrase, I'd say it speeds everything up. Everything's faster. And sometimes it's faster than we would be comfortable with. But we do have to deal with it. We don't always have to deal with it alone. So that will be one of my tips later. Spoiler alert. We might be recruiting some people to help us deal with technology that we are not comfortable with, because it's not going to leave us alone, unfortunately. I usually go through about a liter of water in every lecture, just in case, So. No, that's a thought. Okay, but what is health actually? Maybe we should start with that. Start with that, Jonathan. It's almost 3:30 already. Well, the WHO definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Can you see the date on that one? That's 1948 they decided that, and we've still been wrestling with that. I think it's probably getting better, but I don't always feel like my doctor is really realistically trying to help me have a physical, mental, and social health. They'll ask me a couple questions. Are you depressed? Well, no, of course not, doc. I don't want to. I am totally stressed out. I've got 3 young children that don't let me sleep, and I have a lot of work to do, and I'm moving again. But I definitely don't want to admit to being depressed, doc. But we tend to think in the Western system of health as something that's broken. So I brought my robot picture back for comparison. We tend to think of our bodies as these machines that can just be fixed. And, well, by now we probably know that's not always the case. it is a cultural perspective to an extent, but it doesn't always capture some of the most important aspects of health. Sorry, I'm skipping ahead because I tend to ramble a little bit, and I want to make sure we get through here. So we want to start considering some of these other aspects of health in our how to improve our day-to-day life. Let's talk about healthcare and the patient-provider dynamics here. So we're on to part 2. So current issues in healthcare, in addition to what we just talked about, on the more of the individual level, the issues are experienced differently. Yes, there's global pandemics, but your life is different than, your life isn't always spread around the globe. Some people's are, but yours is here at home, right? So issues that we need to deal with and that can improve our lives, early and preventive care is usually cheaper than acute care. So perhaps you're more familiar with that at this point in your life. If we are healthy on the front end, we don't have to deal with other issues. But preventive care can also be screening, cancer screenings. That's an example of something that has gone down quite a bit in the past 3 years. I'm a collaborative work group member here in Walworth County to try and brainstorm and solve problems related to breast cancer and breast cancer disparities. And one of the common themes I hear from most of our cancer survivors is that, well, they got it at a routine screening, and they put that screening off because it was the pandemic. Well, we're starting to get into the heart of some of the challenges that we have to deal with. That would count as preventive care, and our system doesn't always incentivize it. And then we also have these global contextual issues that are getting in the way of that preventive care. So we need to make sure we prioritize that. We also have healthcare access. This is an issue of equity, which when I talk about equity, and in terms of health communication, what I mean is improving access to health care. So equality, meaning everyone has access to health care so that they can get the care they need, that would be the equitable part. Because health care is, of course, in its nature, discriminate. It is distributive. Not everyone needs brain surgery, right? So thus the equitable part of this. But at any rate, these things save a lot of money and money matters. Money also matters for health. Socioeconomic income, socioeconomic status is one of the strongest predictors of health. So that's another thing that we need to remember. And culture. What kind of culture? Right? I mentioned already the Japanese culture. They are much more focused on preventive medicine, but they're also more culturally homogenous. And it's easier to establish that as, say, a cultural norm, right? That we should all go get screened together kind of thing. Every morning in senior living communities and all the way down to the youngest classroom, they do taiso. They do exercise, right? Hup. They're stretching, it's a lot of this, bending over. Everyone does that in the country, right? That's part of the culture. All right, the complexity of the system, of course. How does healthcare even work? The process, we have a need for structure. Our healthcare system is complicated, and it's defined mostly by this tension between insurance companies and providers. And they go back and forth trying to decide what's affordable, what should be affordable, what we should be able to use. And that's a challenge, right? And we can at least recognize, even if we don't want the government managing our health, we can at least recognize that they're going to have to sometimes. They're going to have to deal with some part of healthcare. Why? Because everyone in this country, citizen or visitor or young or old, is going to have to deal with the healthcare system at some point. In my mind, that places it firmly in the area of the government has to deal with it. But also in my mind, I recognize that the government is very bad at dealing with anything. I don't know. There are some things that they're better at, but. So I think we can probably recognize those two universal truths. The government's going to have some role in it, and they're probably not going to do it very well. So that's the complexity of the system. Now, navigators, nurse navigators, if you've experienced a chronic condition or an acute, or even an acute condition, any kind of condition, you may have had some experience with nurse navigators. That's an example of some people who can help you navigate this system. So that could be useful to you as well. But it adds steps. It adds complexity in its own way. It makes it easier on the patient, but maybe it makes it harder on the providers. So we want to recognize that as well. So now that I've complicated everything, I want to point us in the direction of something positive, something hopeful, because that's what we really need, is positivity. So I think that the most positive thing we can talk about is health literacy. But we're going to have to be a little negative before we can get positive again. I'm sorry, I previewed this hopeful situation. But health literacy is another challenge that we have to deal with. It is the solution to all these problems, however. Well, most of them, or at least part of the solution. So we want to, when I talk about health literacy, I'm sure you can use your imagination as to what that means. But I'm talking about improving knowledge, empathy, and critical thinking skills. All of these are essential parts of health literacy. The empathy part, why would I mention that? Well, that has to do with creating a good relationship with your doctor, which is another strong predictor of health and health outcomes. So when it comes to health literacy, we may think we know the answer to our questions, but we also recognize that health knowledge is a moving target, another thing we've experienced very acutely in the past several years. Now, for older Americans, health literacy may also mean increasing comfort with technology. Older Americans are least likely to use technology, particularly in relation to your health care. How many of you know what a patient portal is? Patient portal. Yeah. That's that fancy online thing where you can get your health records, you can get your test results, you can set up your appointments, all that fancy stuff. They usually call it a patient portal. They might have a different name for it. But that's an obstacle too. That may not be something that you are comfortable using if you don't regularly use a computer, or God forbid you have to do it on a smartphone and you got this tiny little screen and you touch things and then it does something else, and it's hard for everyone. I don't like doing it either. But I do like being able to see my test results without having to go to the doctor and have them, encapsulate that for me, package it up and say, here's your test results. So for many of us, increasing our health literacy is also going to mean increasing our digital literacy. If you're not comfortable with that, it's good to have someone in your life who's a little bit more comfortable with that, and they can help you. That's fine too. That is not cheating. You can do that, all right? So now last, when it comes to health literacy, I feel like I have to put a lot of these kind of caveats into my lectures because I'm dealing with normally a much younger crowd, and they're very passionate. They're very interested in politics. And what I am saying in most of my lectures, all of my lectures, is never political. It is principled. It is based on the protocols that are laid out, and I have to distinguish that. Health is not political. So if you're going to your political party for health advice, you're already on the wrong road. It's much easier. It's easier than trying to engage with the information because the information's hard. It's technical. It's tricky to process it. And it's much easier to just log on to whatever and say, oh, well, the people I already agree with think this. Therefore, that's good enough for me. But health is a moving target, right? It's not political, and it shouldn't be. We should be taking principled stances, not political stances. One is social, one is value-based and moral. But that's a separate lecture. So, what is health literacy? Here's another definition. I have to give definitions. That's part of my job. If that doesn't do anything for you, that's fine with me. It's very technical, but I just like to establish what we're talking about. Here's from the National Academy of Sciences. They say the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions that may affect health of Americans and the ability of the healthcare system to provide effective, high-quality care. Well, that's all fine and good. I think I'm okay with my simpler definitions. But this captures all the things that we need to engage with. So I'll probably skip ahead a little bit here, but just to make my point, 88% of U.S. adults are below the proficient level of health literacy. What does that mean? The proficient level of health literacy means that you might be able to find the information required to define a medical term by searching through a document. So you could process that definition a little bit. I find that a little bit alarming. That's 88% of Americans are estimated not to be able to do that. So, when I say health literacy and improving it, I'm not talking about like everyone becoming an expert in mRNA nanolipid technology, okay? I'm talking about being able to use that handout your doctor sends you. I'm talking about being able to look at something and determine when you have to go to the doctor, when your next appointment is. Intermediate means might be able to determine a healthy body weight for a person with a specified height on a BMI chart. I'll show you an example of that in a second. Basic might be able to state 2 reasons a person with no symptoms of a disease should be tested for the disease based on information in a clearly written pamphlet. Now, this might have changed a little bit since the pandemic began. Below basic might be able to locate and circle the date of a medical appointment on a hospital appointment slip. That could be a problem. That could have some serious consequences for your health. But it starts to paint a clearer picture as to why we might have challenges getting people to get to the doctor for their yearly mammogram screening. Okay, this is a body mass index chart. So again, the intermediate level would be, one of the ways of measuring that would be being able to look at this chart. I am 6'2". I weigh about 145 on a good day. That's just who I am, right? But that gives me slightly below or underweight. That's how you read this chart. If you do, intermediate level would be about there. All right. Now, this part here, I wanted to introduce the idea of identities in this. And I want to talk about patient and provider identity just for a few minutes, just to remind us, and I could summarize this in one sentence. We're all human. You and your doctor are both humans. And one of the best quotes I've seen in health communication literature is stressing that we should think of both people in that exchange as reasonably good-intentioned people, reasonable people of reasonable goodwill, exchanging, right, and trying to do things. We have to assume the best about each other, but we also have to be realistic. So now, when it comes to our identity, we're talking about who we are. How do you know that? How do you represent that person? How do you maintain that person? In communication, we call this face work. It is a communication process. Don't worry about that too much, other than just the reminder that we're individuals interacting and we present a certain face to each other. So here are some different categories of identity that we discuss. Personal identity, exactly what it sounds like. How do you define yourself? Your social identity, how does society view you? Right? We have our avowed identity, who we are. We have our ascribed identity, who society sees us as. That could be contingent on some of our roles, our age among them, our race, our religion, right? That would be part of our social identity, how society views us. But then in health communication, we introduce this other idea, this third identity, tertiary identity, which has to do with our sense of health, modified by health status. How might you be defined by and in relation to your health? This could be related to natural progression of age. It could be related to a chronic condition. As I mentioned before, I've got a form of arthritis. That didn't mesh very well with how I viewed myself at 28. When I was diagnosed with arthritis, that was like, my finger swelled up like a sausage. I'm like, how am I supposed to play video games with this thing, right? That's not who I am. I'm healthy, I'm young. When we are faced with this tertiary identity, we have to redefine ourselves a little bit. But that's part of this. That's part of why when we come into a healthcare interaction, we are viewing it with a voice of the life world, is, a fancy feel-good way of talking about these different competing perspectives in healthcare. The patient uses the voice of the life world. We view our health through feelings and contexts. It's diffuse. It has to do with how well we can get out of bed in the morning and how much we can hold our children and what we can eat and what we can't eat. It is comfort-seeking. It is emotionally expressive. Whereas the voice of medicine in Western culture and all over the world, really, well, we're talking about experts. Right? They are focused on evidence, measurement, precision. It's treatment seeking. It is emotionally controlled. That's part of it. Although, in the healthcare profession, we would consider that an occupation that is high in emotional labor. Right? Remember that the kind of people who become doctors are the kind of people who care about other people. And so that leads to a lot of burnout for them as well. So we can skip over this. This is a little bit redundant. Other than this is an exercise I have my students go through sometimes, is just trying to understand what kind of tensions we might be introducing with these two different perspectives. Are they truly competing, or can they be complementary as well? I like to think the latter, but on the surface, we might think that they're at tension with each other. Right? The dilemma of experts is that they speak a specialized language and they think in a specialized way. That's very different than the patients who think of health in terms of their life and their experiences, because they're the ones living with it. They don't get to say goodbye to their arthritis when they walk out of the office. Right? Wouldn't that be nice? All right. This slide, I will share my slides if that's of interest to anyone, but here are some tips just for your own consideration that are recommended for providers to try and have a good life and not be burnt out. And you'll see some similarities between these and things that I think that you can take forward, right? So for providers, it's recommended that they have daily briefings with themselves. What made them feel what today? Can they engage with that? When they get to the end of the day and they feel definitely not depressed, why are they feeling that way, right? What made them feel that way? Being mindful of things that make you happy. Invest in gratifying relationships. Design your own time pie, as it were, right? You only have so many slices to go around in the day. How can you divide that time up? Spend time with people that replenish you rather than drain you. Well, I think we can all agree that these are pretty useful tips for everyone. But we can also recognize how important that is for a healthcare provider who gets 15 minutes per patient, and they're seeing things all day long. If you want an example of what the emotional labor doctors have to go through, imagine being I could never be a doctor in the PICU, the pediatric intensive care unit. But imagine the kind of person that takes that job. They take it because they love children, but most of that job is watching children be in serious, serious harm, if not dying. That's exhausting, right? And we want to try and be compassionate towards our providers if we want to have better outcomes in our own exchanges. That's my brother in 2010. He looks a little older now. But I took this picture when he visited me when I was living in Japan. Pictured behind him is the drink section of the local convenience store. And it's a little baffling because it's all in Japanese, but trust me, if you speak Japanese, it's still baffling. Another picture I could have put up on here is a picture of a poster that had a painting of Marie Antoinette holding a bottle that says the placenta on it. What are they selling? I'm not really sure. I had to translate it. It turns out it's like bovine placenta. It's like collagen. It's like for your beauty. I don't know. But the point is, health and well-being is not always so straightforward. The other picture is just a dude fishing a channel in the Sea of Japan. I always liked this picture just because you can see all that technology and all that stuff, and he's just hanging out on this little island fishing. And man, there's something about that disparity that makes me feel, I don't know, at peace, perhaps? I'm not sure that's the best way to describe it. But at any rate, so here's some tips. Now we're getting to the tips for you guys, okay? Finally, with like 5 minutes to spare. Good job, me. All right, so the complex system. I've broken this into two things. One way, dealing with the complex system that we are all stuck in, because we can't snap our fingers and fix the healthcare system as much as we would like to. And I don't want to take responsibility for that. And I've been studying this stuff for a decade. It's complicated, right? But we can improve our experience within the healthcare system. One, improving our health and digital literacy. I'm not trying to pick on you people who don't like using computers. I just want to remind us that that's an inextricable part of our lives. We're going to have to. And if you don't do it, someone else is going to have to do it for you. Unfortunately, it's just what we're dealing with. But that is an opportunity. That is an opportunity to involve your friends. It's an opportunity to involve your care providers. It's an opportunity to involve your loved ones, your children, your grandchildren, if you have those people in your lives. I wish my grandparents were still around so that I could help them with this stuff, because that would be a great bonding experience. I used to love going and hang out with my grandpa just to build whatever wooden boat that, you know. My grandpa had polio too, and so he was very limited in his mobility, and I never really appreciated or understood how hard it was for him to go from upstairs down to the basement just to work with my skinny butt on some wooden boat. But that is an opportunity for exchange and developing those relationships. So whatever relationships you have, cherish those. That's going to be another tip, recurring theme here. But that can help us improve our literacy. The other ways we can do that, well, I'm going to talk about these all in greater detail as we go along. I should probably just get through them first. Make it easy on healthcare providers. That means cultivate a relationship with them, and there are some tips to do that as well. I'm going to give you a little more detail on all of these. I was just trying to preview it for you. We also want to network with support. That can be our peer groups. That can be our providers. That can be support groups for our specific condition. And here, I think, might be the number one most important thing you can do. Listen to your body. Okay. I'm going to repeat myself a little bit. That's the preview, but let's get into those details, okay? So improving health and digital literacy. Again, technology can be overwhelming, but it is designed to be intuitive. I can pick up my phone and I can touch it, and it will respond to my touch. That's incredible. That wasn't a thing when I was a kid in the 80s and 90s. I remember rotary dial telephones. Man, were those satisfying, huh? You just ratchet it around and you click back. I miss those. Kids today, they don't get that. But technology can be overwhelming. It's designed to be intuitive. Who is it designed to be intuitive for, though? Digital natives. These would be your grandchildren, et cetera. My children are touching the TV, trying to get it to play. Daddy, why won't it work? Well, it's not magic, son. It's just TV. But he's already learning how to navigate that with buttons. It kind of scares me, but at the same time, there's going to come a time in my life where I'm not going to understand the current technology, and he will. And that's great, okay? So, but you can explore. All of you can. You can explore health information. There's so many resources out there, but you have to be prepared to dig into it. You have to be prepared to be wrong. Improving health literacy is a process. The first step is taking interest in your health. Next, ask questions. If you don't understand something, ask questions. Ask questions like if you read health blogs or whatever, that's fine. But you also have to be willing to be wrong. That's part of it. So doing your own research is fine. I strongly encourage it. I strongly encourage you to the best of your comfort, try and understand what mRNA technology does and what it doesn't do. But you also have to be willing to be wrong and be willing to ask those questions of your providers. Right. Making it easy on those providers. Develop a relationship with your primary care provider if you haven't already. I'm sure you probably know them pretty well. But do try to be aware of their constraints, again, those mental constraints and their time constraints. I asked one of my doctor friends, hey, I'm giving a lecture on patient-provider communication. Anything you want me to tell people? And she laughed and said, don't come in with a list of 25 things for me to fix in 15 minutes. So, but from the patient side of things, maybe I don't want to make 25 appointments, okay? Right? So we have to negotiate that a little bit, but we want to be conscientious of it. Maintain a roster of key players. So get a journal. Look at me. I love paper. I love writing on it. Write who did you see, when did you see it? A planner, a journal, anything can do that. Keep a list of who those people are. What are their contact information? What do they do for you? What medications are you taking? Who are your different specialists? And think about how they interact with each other, because they are supposed to be a team. And they may not be talking to each other very much, and so sometimes you might have to pick up the slack on that. But that's an easy way you can do that. Keep and share clear records, again, on the same point here, of your meds, visits, allergies, etc. You can make a printout, you can keep a planner, just keep a good list in your mind, but you know the information the doctor is going to ask you for every time you go. You can make it easier on yourself by writing it down, and them. Networking with support. Number 3 on my list here. Experienced connectedness is a factor in well-being. One of the things I did to prepare for this lecture was I was just digging up some current literature on, well, what really helps older people thrive and have well-being and have good health outcomes. Well, experienced connectedness is a part of that. So if you're part of a community such as this and you have peers, that's wonderful. Let that make you feel good. It's good to have peers. It's good to have friends, and you've got that. So, and that is a huge factor in well-being. You probably aren't the only one experiencing what you are. There are specialized groups that are focused on whatever condition might be bothering you, other people who are going through the same thing. These are all the reasons why that helps. Another tip here is to recruit a personal health care quarterback. That could be a loved one, a partner, a friend, or a care provider, but someone who can share in your perspective and see that big picture with you. Each provider is getting a piece of the puzzle, but they're not seeing the big picture. And so having someone to help you with that can be really beneficial too. Consider partnering with a nurse navigator where available. There are resources available for you to navigate this complicated system. If you find yourself with a cancer diagnosis and the doctor offers you, hey, we can put you in touch with one of these groups, take it. That can make your life a lot easier. You won't feel so alone, and they can help you. They can help other people have been through this before. Nurse navigator, that is a specific profession that is designed to help people navigate all of this stuff that I just talked about. That's their job, okay? So if you get an opportunity to work with people like that, take it, right? All right. I love this meme. I don't know if you've seen this before. We call these memes, right? It's just a cartoon or something that's getting a point across. This is how I feel sometimes when we're in the thick of it. But I put this on here because that's what I thought of when I thought of this tip. Listen to your body. Don't ignore it if the room is on fire. Don't ignore it if your joints are on fire. Don't ignore it if you're experiencing something new and different and not pleasant, right? Does something feel weird? It's probably weird. Trust your body. It's just a dog in a burning room, and he says, this is fine. Why? We don't know, but this is a very popular comic. People like to use that to describe everything from politics to health. Doesn't that perfectly describe the political climate? I mean, probably doesn't really matter what era we're in. That probably could equally apply. This is fine. All right. Anyway, now here's the last part I'd like to leave you with. These are tips for your well-being, because I wanted to make this actually useful and interesting for you and simple enough. You're probably not going to remember all that crazy stuff I talked about, but here I came up with a little acronym for you: EMS, not emergency medical services. This is a way to avoid those people. Remember that health is multidimensional. Your health should reflect efforts in all areas. Exercise, and I put eat in here too. It could be physical, but I didn't want to make this PMS. I thought this was better. So exercise and eat. So your diet does matter. Movement matters. You don't need to lift weights. You don't need to jog unless that's your thing. I swim. I can't lift weights either. It would destroy my joints, but I swim a lot, and that makes me feel so good. So whatever you can do, whatever feels good, exercise. Take a walk. Take a lap around the room. Stand up, sit down, whatever it is. Anything's better than nothing. And diet too, I guess. I'm no nutritionist, but we should probably cut out vegetable oils wherever possible, because those things are just terrible for you. All right. Mental, faith, meditation, napping. Whatever your religion is, practice it. If your religion is napping, by all means. But when I look into the quality of life literature, what I see, one of the strongest predictors of well-being, quality of life, reported by older people, is faith, religion, particularly personal faith. Now, I don't mean you can be an atheist and still have faith. I mean, we all have to believe in something. Even believing there's no God is believing in something, right? But whatever it is a way of dissociating ourselves from the things that bind us here to this earth. And whatever you do to deal with that or not, whatever brings you comfort in that, and practicing the ritual, that is all really important. But that's just one example of mental well-being. What's good about religion is I think, the structure, the social interactions, and it reduces uncertainty. Uncertainty is the greatest source of stress and anxiety for us. So whether or not there's a God waiting for us on the other side is less important than how we walk through our day-to-day life and feeling alleviating that sense of dread. So faith is one way of doing that. Meditation is another way of doing that. Mindfulness, yoga, all of these things help because they get us a little bit more aware of ourselves and our interaction with the world. And then, of course, social, family, peers, friends, interacting with your friends, whatever you do, I recommend finding time in your day to do something from these different categories, all of them. And that's enough. I think that's enough to really improve our well-being. So, EMS, I tried to make it easy on you, and I'm going to try and do this too, because I don't always do it. I mean, I get exercise carrying the kids around and going up the stairs, but I think I could do a little better than that. So, there you have it. I hope you have some daily EMS, and maybe that can simplify things for you. That's all I've got for you today. All right, there, sounds simple, doesn't it? And I've got my references list if you want that too, but there you go. All right, thank you very much. Sorry I went over time. Any questions, please?
Please join me in thanking Professor Jonathan Dellinger.
Thank you.